Hi, thank you so much for joining another episode of Take One Patient podcast. My name is Julie Soukup. I work with the medical memory, and I'm very excited about our two guests today, Dr. Grin Lord and then Dr. Jolly with Empathic. Thanks so much for joining. So I want to actually let you guys start by introducing yourselves and talk a little bit about what you guys are trying to accomplish as it relates with doctor communication. And then we can kind of talk a little bit more about what we're doing and how we, partnered or looked at partnering. But yeah, why don't you guys go ahead and start by introducing yourselves?
Great. Thank you so much for having us. I'm Dr. Grin Lord. I'm a licensed clinical psychologist. I've spent the last 15 years studying what are the words and phrases that lead to increased empathy and trust in doctor and patient communication. And most recently, we've been giving performance-based feedback and coaching using AI. So rather than having a human coach say, here's what to say next, and let's look at this, we actually have had hundreds, if not thousands, of humans build this AI, experts in communication, to then deliver that at scale. I'll let Dr. Jolly introduce yourself.
Hi, I'm Dr. Jolly, and I am a licensed counselor. And I've been working with Grin, or Dr. Lord, for the last almost 3 years. And I'm one of the humans who's behind the AI, who is helping create the performance-based feedback, and who's been overseeing the teams that are that are generating our AI.
Awesome. So, as you know, we've met. My background is in performance coaching with cosmetic sales, with trainers. Working at Clear Choice, and one of our partners being Sona Bello, where we actually were using coaches and trainers a lot, where we would record, our consultants and the way they engaged with patients and the way that they communicated, and then we were recording it and then trying to train and coach remotely and leveraging medical memory with that. Tell me a little bit more about kind of what it is that you guys are really looking for in a lot of these videos. And then also, how are you going about measuring it?
Yeah, that's a really good point. I should say, too, I was also a coach, a medical coach for a long time before I became a psychologist. And it is really tedious to listen to these recordings and try to be objective and unbiased, especially when you've been, doing that a lot. One of the kind of things that inspired Empathic was a nationwide study, the Clinical Trials Network, where we actually had, I think it was the largest phone coaching study that's been conducted to date, where we listened to providers and doctors and marked all the good and bad things they did, and then coached them and had them do role plays and rehearsals. And at that time, actually, we used an objective measure called the Mighty, which was based on motivational interviewing, has a lot of research around if you use things like reflective statements, open-ended questions in the medical context, that actually improves healthcare outcomes. So we use that objective measure to rate sessions, but it was super latent. People would get feedback about 2 weeks after they saw a patient. They wouldn't even remember who the patient was. So even though the coaching worked, similar to learning a sport, that's how you want to get your feedback when you're training a communication behavior. It didn't really work to have it be that delayed. So that's when we built some of our first AI models, was taking all of the things that coaches did, training AI on it, and going from there. But that became the basis for a lot of the science behind our work, was starting with lessons from counseling and psychology and healthcare coaching, things that we are tested and have been working for at least the last 20 years in healthcare settings to show objective ratings of empathy. I don't know, Dr. Jolly, you can talk a little bit about how we define empathy, and trust and these things. It seems like, so subjective, even though we have objective definitions for it.
Yeah, we take a broader understanding of empathy, and we really try to look at it as accurate understanding. I know in a lot of psychology and in counseling spaces, they often talk about empathy as being able to walk in somebody else's shoes, and that can seem a little bit intimidating for people who maybe don't have that background or that training. So what we're really looking at is this person able to accurately understand? Are they making attempts to really, summarize, restate, or yeah, just increase that understanding in the conversation.
Right.
Well,
So
and
it's
it,
like
go
oh,
ahead.
go ahead, Julie.
I was just gonna say it's interesting too, because and we face this challenge as trainers and coaches for our consultants is trying to take that subjective nature out of it. How are you measuring it, and how to kind of make it be, okay, this isn't just my opinion, this is something that potentially you need to see and change or shift behaviors, as it relates, to your conversation or the way that you're talking to people and whatnot. Now, tell me a little bit. I mean, I was in cosmetic sales, which was obviously you want to get, encourage or motivate someone to change their life and do something different. But we met in a neurosurgery space, which tends to not be a place where, communication is always like the main important thing. These are the best of the best in some surgery spaces. So what were you guys kind of trying to accomplish, and how you got started working with Virginia Mason, which is actually where we met?
Yeah. Well, there are some incredible surgeons out there that actually understand the literature and value, bedside manner and doctor-patient communication. And Dr. Faroki at Virginia Mason was one of them who had been already trying on his own to improve the coaching in a more objective way of his residents, other surgeons that are training, as well as team members. They would do I think a kind of a grand rounds thing once a year where they would have 15 surgeons come in to watch a surgery and give feedback. Incredibly resource intensive and rare. And if you can imagine being a surgeon getting feedback one time a year, doesn't, totally shape your behavior. But the reason he was so excited about that is because there is research that shows that what they call non-technical communication skills, so that's everything that doesn't have to do with communicating about the surgery, actually predicts better surgical outcomes. So that's how the doctor or surgeon talks to their team, as well as how they talk to the patient. If they increase empathy, trust, and understanding in those conversations, it actually reduces things like length of stay, other medical outcomes, healing, errors that happen in the communication. More trust is built between the teams, so people are more likely to bring up issues or stay, on that team and not churn. There was an interesting study that came out about physicians' assistants churning under surgeons, that are operating in a more like traditional stereotype we have about surgeons, being the king of the hospital and coming in and needing all these things and demanding them. The more collaborative ones have greater retention, again, better healthcare outcomes. So I can keep going on the literature, but Dr. Faroki was really interested in how do I improve? How can I monitor this? And then with medical memory, they were already using medical memory to help with, patients that after a neurosurgery, maybe wouldn't remember what the doctor said, because obviously that's very traumatic, or they just found out, they got brain cancer or something. And, we as psychologists know anytime you have a trauma, psychologically, memory is one of the first things that goes. And then add on top of that a surgery to the brain. You need to have a video playback review of what's happening. So he already was invested in medical memory and that communication, and then wanted to add on top of that, how can I improve this from my perspective, not just for the patients to learn and remember, but how can I actually use this to maximize my time, workflow, speed, as well as performance.
Yeah.
Yeah.
And it's a really amazing kind of this time that's evolving, and especially with what you guys are doing with these tools is, yes, you're able to capture more things on video, whether it be conversations with your patients, conversations with your team, to be a more effective, and collaborative leader, all leading to, hopefully better patient understanding and better patient outcomes. But I think it's amazing that taking that resource, like, okay, now you have this video, what are we going to do with it? And being able to kind of pull that information out and analyze it, in empathic, and be able to understand, what are these metrics that we're trying to uncover with the transcript and the words that are said, and all of those things, where it's allowing people to kind of really be more introspective or more aware of themselves as it relates to their team. But also it's like, okay, well, now you're being recorded. For those of your partners, or even for Roki, I guess he already was into medical memory, but for some of your other partners that are like, okay, well, I want to plug this in through here, but I'm nervous about having this recorded. I mean, kind of how do you help encourage or persuade or whatever, as far as like, well, this is what you could learn from this?
Yeah, that's a really good point. I think provider buy-in on all of this is extremely important. And for us, we prioritize, self-review first in our system. So the idea isn't you get a recording, it goes to your supervisor, and then they shame you or, reduce things for you. The idea is that you're the first one to look at that. And Jolly, I don't know if you want to talk about maybe some of the structure of the feedback with like strengths and challenges, how we actually give the feedback so that it is, digestible.
Yeah. So yeah, our goal of the feedback is to, shape behavior and encourage people to help people understand where they're doing well and where they might need to improve. So we don't just hone in on areas where like, hey, maybe this was a little confrontational, or you could have asked a question differently. We also hone in on the strengths. So you did a really good job summarizing here, or this was a great reflective statement, because we want it to be balanced. We know that if you just focus on the areas that somebody's not doing well, it becomes demoralizing.
Yeah.
And so we really want we want the people to be engaged. And so we know from the research that in order to do that, there needs to be a balance of positive and constructive feedback.
Yeah. And we even see that working with our cosmetic surgery coaches, and they're training these guys, is sometimes it's like, you did a great job with this one thing. This is awesome. You should do this all the time, like as far as like asking more open-ended question or slowing the pace down, to show more empathy. That a lot of times it's being more aware of the things that you might already do really well, that it's just automatic. You don't even think about it anymore,
Some of it is a knowledge gap too. There could be highly empathic people. They get good patient satisfaction ratings, but they may not even themselves understand what is the exact skill that they're doing that is leading to that.
Yeah.
So they can't train others in it. It becomes like, this industry knowledge to this one person. So this also helps people, share what they are doing well with others. For some of the surgeons where there's less buy-in on recording, they're not interested in improving that. There is some good research, showing that recording these conversations does not increase any malpractice suits. Some people worry about that if we record this and suddenly we're adding to the record. In fact, it's the opposite, and legal teams encourage to have these records and ongoing communication with the patient that is recorded. So there is a lot, understanding's increasing just through that medium alone,
Yeah.
let alone the skills.
Yeah.
And then again, you have some of these workflow things that can be sped up. One of the things that we can kind of double dip into with our AI recording is summarizing the session so that surgeons can very quickly understand what is going on. They can use that for their clinical note if they'd like to. They can use that for a patient summary. So it's helping them with their memory as well.
Right. And what they can kind of copy and paste and be able to give off to a patient, even if they're not wanting to give the video or whatnot.
Right. There's there.
Yeah. So from a lot of these, doctors and psychologists and your analysis, is what would you say, just even as skill sets, really separates the ones that are much more empathetic and collaborative versus ones that don't? Like what are like kind of the key things that separates top communicators in that space?
Yeah, it's interesting because we can talk about two areas there. One is what we call common factors, which are the things that in psychology research basically have been shown to be the active ingredient or component in psychotherapy and coaching. And then the other is more specific to surgeons themselves, and that we actually use a metric called the NOTS, which is the non-technical skill set. I'm not sure exactly what it non-technical skills for surgeons, which is a measure that comes out of the UK. And so how we like to think of these skills is what skills, like what happened, versus how skills, like how did you do it?
Right.
So Jolly, do you want to talk a little bit about like the how skills, and I can talk about the what?
Yeah. So the how skills are kind of more about like how collaborative you are. Are you asking like really curious types of questions? Are you, and respecting other people's expertise, inviting them into the conversation, and using restatements and summarization and things like that. So kind of more about, it's more about like your presence in the conversation.
Sure.
And so,
Yeah, like collaboration and power sharing is a really important one, emphasizing the control of the patient during their process so that they know at any point, if they have questions or if they want to stop or if they don't want to move forward with something, that they have options and choices. And there are little phrases that you can say to emphasize control, like, what do you know about this surgery before you tell them?
Yeah.
Like, tell me about your understanding of the risks before you tell them, so that you can get a sense of like, well, okay, where do I need to focus my energy? And having them come across as the expert will increase their confidence going into that surgery. Or things like, did you understand that? Did you have any more questions? Which is like a super obvious thing to those of us here that are coaches, but a lot of people, they come in, and we can talk a little bit about the bad behaviors, but the bad behaviors are things where you just dump information on
Yeah.
people and you don't pause, you don't check for understanding, you don't like that power sharing, that collaboration piece that Dr. Jolly is talking about is like one of the many metrics we focus on. And it's actually super easy to fix. You just have to know to pause, to be like, are you understanding this?
Yeah.
Like, what is your understanding
Yeah.
throughout the conversation?
Yeah.
Um,
That's
we have
great.
other metrics too. I don't know if you want to talk a little bit about curiosity or. Uh,
yeah. Yeah. And so for curiosity, that's more about like asking like really curious questions. So asking open questions, questions that are inviting other people to expand. Because a lot of times you can start with an open question. So tell me about what's bringing you in today. And then from that, you can get a lot of information, rather than say being a little bit more directive, asking a lot of closed questions. We know that there's a time and a space for closed questions, when time is limited, when there's very specific assessment that you need to follow up on. So we're not saying that closed questions are bad, but what we do recommend is starting with the open questions to give people a space to really give the history of their problem, the history of what is bringing them in, and then from that, asking those follow-up questions, to get a little bit more targeted discovery.
Sure.
we have like a highlights and challenges that pop up. And one of the ones that we see frequently with questions that's a problem is when people will do stacked closed questions without letting the patient respond.
Yeah.
So, or they'll do an open-ended question like, what brings you in today? Was it your knee pain? Was it your shoulder pain? Was it your thing? Was it your blah, blah? And I just like to begin, like you see this with residents a lot. They'll just begin a medical checklist because a lot of medical school training is that diagnostic rule out type
Sure.
thought process. It's like you can get to the rule out with just asking the first question. So it's a lot of like unlearning some of that thought
Yeah.
process that they think actually will lead to speed and accuracy. And again, the research says no, if you let the patient tell the narrative first, you're going to get all the information you need with like nudging and reflecting your understanding
Right.
rather than going through your checklist.
Mhm. Well, and even that's what you're saying is if you're saying, okay, like from all that is we were going to say, okay, here's two keys for any provider that we've learned throughout the analysis and the data is, even write pause on your hand to just have that one open-ended question at the very beginning and
Right.
then pause, write
Mhm.
pause on your hand just for those check-ins. And even just in and of itself, that is
Little
going to
things.
build a better patient experience for that.
Mhm.
Or reflective statements, like when they say something to you, repeat back what you heard before you go to your next question, especially if it's an open-ended one where you've gotten a lot of information. Um, and I've seen this happen live with providers that are just using reflections and they get so much more out of the conversation in terms of really understanding where their patient's at, just through repeating it back, because sometimes patients themselves don't know. They don't know if they're making a medical decision. That's a big one, even if it's something, again, in your industry, in the cosmetic industry, people are ambivalent. They aren't sure, do I really want to do this? Do I not? Am I okay with the risks? And so just repeating back okay, it sounds like on the one hand, you're really like looking forward to this. On the other hand, you're a little bit concerned about the follow-up because of your past experiences. Like where are you at right now
Yeah.
between those two things? Like just repeating that back to them can help them come to a decision where they're going to have more confidence in you.
Yeah.
And it
No, and
also
that's
helps.
very true. When we would look at like coaching our dental consultants or plastic surgery consultants, a lot of times these people would come in and this is the first time they've even talked about it. Like
Sure.
the first time they like you don't go somewhere and be like, let me show you my biggest insecurity. Let's talk about it. Like, so a lot of times they just needed to like just talk for a minute and get that kind of out. And even similarly, I mean, in the more traditional medical setting, it's not as much, but this isn't something, even having my dad deal with spine issues, he's not telling everybody about these things. This is sometimes not a rehearsed thing that they almost have to work through a little bit and have that space, kind of to do it, which is where you're saying is those check-ins and that open-ended, is even reflecting in the data that providing them that control back and at least that space to be able to communicate about it a little bit.
Were you going to say something, Jolly?
Oh yeah, I was gonna just tag on about the reflective statements. It also really helps uncover any of your own misunderstandings. And so if I'm just saying, it sounds like, it's been really bothering you in this area, and then that gives the patient a chance to correct.
No, yeah.
and say, no, that's actually not.
No.
Yeah. And so,
Sorry.
and so there's a lot of benefit to it. And so I think, it's just a really important skill for us to keep practicing and using.
Awesome. Well, I'm so excited. I'm so excited that we've gotten to meet you, especially, with medical memory being a tool that can now capture these videos that can now be analyzed, whether that be in neurosurgery or cosmetic surgery, or just trying to learn a little bit more of some analytics behind some coaching, I think is going to be super, super powerful, and being more aware even of this, personally, as well as starting to kind of have some of our clients start to see this, I think is going to be incredibly helpful for, giving that expert coaching without necessarily having someone sit right next to you in the room,
Right.
which of course can only help improve, communication with their teams or patients or whatever it might be. So I'm so excited to continue to see how this is going to evolve, as well as what we're going to learn, in these different specialties about communication. Before I wrap up, is there anything else that you guys want to add or anything?
I think one part that we're really excited to get into too is benchmarking some of these skills against other objective measures like patient satisfaction, Press Ganey scores, things like length of stay, and even against other surgical teams or other teams, in a more anonymous fashion, so that people can really get a sense of how am I progressing? Why does it matter that I have an open-ended question and emphasize control? It's not just to be nice, like this is the actual impact on that. So having almost like this feedback system on I'm doing these behaviors and this is the impact it's having can be very motivating. And that's where we're headed next, is not only analyzing what's happening and comparing it to what we know works, but also comparing that and benchmarking that against teams, against hospitals, and then pulling in some of this other objective data. So I'm really looking forward to that too, since that will be, I think, maybe one of the first times, at least that I'm aware of, that there'll be that direct connection that isn't based on just a complaint surfacing. So something's bad, so then you look into it. It's like, okay, we're going to know in real time, like what's contributing to these good scores versus the others.
Right. Which takes time, a lot of time, as far as to be able to like get the information and pass it along, especially as it relates, I know with HCAPS, when we were working on a few studies during COVID, which was, showing that adding medical memory for doing rounds and doing patient updates did lead to patient satisfaction as far as understanding communication, whatever. But I know even when we did it was such a lag in that. So it's exciting to see kind of just as you said, how you can shift these little nozzles here and what a really big impact it will have on these other places. So I'm excited for that. So thank you guys so much for joining and hopping on. It'll be really interesting and exciting to watch all we're going to be able to learn from this technology that you guys have built. So awesome.
We're excited too. Thank you so much.
Yeah, thank you.